Greetings, everyone. Good morning, good afternoon, and good night, good evening, from which part of the globe you are hearing from or accessing this webinar. Welcome you all. My name is Solomon Wesley Sua. I am the founder and CEO of Rapha Digital Healthcare, PNG Limited. And I also started Cybersecurity PNG Limited and also Pacific Artificial Intelligence Consortium. So these three organizations, Cybersecurity PNG Limited, Rapha Digital Healthcare, and Pacific AI Consortium, we are looking at how we collaborate to bring digital healthcare and power it with artificial intelligence. Together, these organizations form an integrated ecosystem delivering secure, intelligent, and fully connected digital solution. So we're trying to bridge cybersecurity, artificial intelligence, and healthcare. So together they can, cybersecurity takes care of the threats and cybersecurity aspect of our digital healthcare solutions. And the Pacific AI Consortium takes care of the AI side of digital healthcare, and Rapha Digital Healthcare is a digital healthcare company. So we believe that by fully connecting these digital solutions across artificial intelligence, across cybersecurity, and across digital healthcare, we can bring a solution that is powered by AI and it's secure. AI and cybersecurity at its core. So by combining AI, analytics, and digital health innovation, we aim to strengthen public health systems and enhance critical clinical efficiency and improve patient outcomes. So Cybersecurity Limited provides the cyber defense backbone, and Pacific AI Consortium drives the AI innovation side of it, and Rapha Digital Healthcare drives the digital healthcare component of it. So that is what we will be doing today, and I want to make it below 30 minutes so it doesn't get a lot of time. By way of introduction, artificial intelligence is transforming healthcare, as we know, not only in PNG but across the world. It is already, it's already having a huge impact on healthcare service delivery. So we believe that us coming together to bring AI-powered solutions with cybersecurity and its core to Papua New Guinea, we believe that we can drive digital transformation, empower what the DICT, Department of ICT in PNG, and NCD PHA and our other PHAs across the country, and all the DTOs for all the PHAs coming together, and whatever they're driving, we believe that we can be a partner to that. So in a way, we provide that platform and get the things going. We believe that AI, cybersecurity, and digital healthcare need to come together. And that is one purpose that we're trying to introduce in this. So in this presentation, we will delve into how AI is impacting key areas such as medical diagnosis, personalized treatment, patient care, and hospital operations. So the integration of AI not only enhances the quality of care, but also opens up new possibilities for future innovations in the healthcare industry. And the third slide, we are into the role of AI in medical diagnosis. So artificial intelligence is significantly enhancing the accuracy and speed of medical diagnosis. AI systems can analyze medical data such as imaging scans and lab reports, patient history, to detect patterns that may not be easily recognizable by humans. So this leads to more precise and timely diagnosis, especially in the fields like radiology and pathology. Additionally, AI has the potential to revolutionize early disease detection. So by analyzing vast data sets and identifying indicators, AI can assist in predicting conditions such as cancer or health disease or at the early stages, giving patients a better chance of successful treatment and recovery. So that is at a broader level, the role of AI in medical diagnosis. So among all applications of artificial intelligence in healthcare, medical diagnosis is perhaps the most transformative. So AI systems can analyze all these complex data sets, like coming from CT scans, MRI, X-rays. So in Rapha Digital Healthcare, this is what we're doing. We are not replacing systems that are already being used by, let's say, hospitals under the PHA. In the PHA structure, we see that there's one provincial hospital, and then there are district hospitals and other facilities in that range down the hierarchy of medical care. So we don't replace the systems. If there's a system already in place, then with our AI-powered tools, we can pull in the data that is already existing, like in Port Moresby General Hospital. We don't go in and replace all this. So we see our solution is designed in a way that it will retrieve data from Excel spreadsheets and Word documents, anything that is digital in a computer system. Our system can do so. Now that we are putting in AI and cybersecurity into its cooperation, then it is all secure, and it will cut down a lot of time in how we deliver services. So that's the role of artificial intelligence in medical diagnosis. In AI in personalized medicine, artificial intelligence is enabling a shift towards personalized medicine, where treatment plans are tailored to the individual needs of each patient. So by analyzing like genetic information or lifestyle factors and medical history, AI can recommend customized treatments that are more effective and better suited to each person's unique profile. So it's a tailored treatment plans. AI enables the development of customized treatment plans based on individual patient data, including genetic information and lifestyle factors. And then we do what we call the predictive analytics. By utilizing predictive analytics, AI helps healthcare providers anticipate patient outcomes and allow for timely and proactive interventions. So you do the diagnosis, and then AI will then do a predictive analytics. So that's where precision medicine and precision care comes in. So AI, this is like personalized, so it's no longer broader. So AI can, within a shorter time, can see the history of the person, like genetic information or any other lifestyle factors. If someone is, let's say, drinking too much, taking in too much alcohol, or smoking, or chewing betel nut, and then what AI can do is put that into the predictive analytics machine. Then it does this predictive analytics where it can predict, let's say, critical organ failure. That's we've seen lately. A lot of people are dying like when they're reaching 52, 54, 56 years old, and all of them are contributed by, let's say, public health factors like drinking a lot of water, alcohol, and all this. So it's causing this a lot of things. So with predictive analytics, we can now have the opportunity to predict, and then improve effectiveness. So that's personalized approaches, enhance treatment effectiveness while minimizing potential side effects and leading to better patient experience. In a country where we have, let's say, 600, 500 to 700 doctors, and we have about 11 million or 10 million around that population, then you see the doctor-patient ratio is pretty high. Probably one doctor is to 30,000 or 100,000 or something. Then we need AI to fully utilize the doctors, the limited number of doctors and resources that we have. So one specialist doctor, then assistant from AI, can then attend to patients across many healthcare sectors. The next slide we are on is the artificial intelligence in healthcare procedures. So artificial intelligence is making significant advances in the field of surgery, contributing to improved precision and patient outcomes. AI-powered robotic systems assist surgeons in performing complex procedures with greater accuracy. And this technology will reduce invasiveness, which can lead to shorter recovery time and fewer complications. So there's two there. One is the robotic assisted procedure. AI enables the use of robotic systems that provide enhanced control and precision during various healthcare interventions. So this technology allows for minimally invasive techniques, which can reduce physical impact on outcomes on our patients, and enhance precision. With AI's ability to analyze real-time data, procedures can be performed with greater accuracy. This precision helps ensure that critical areas are preserved during interventions, leading to better outcomes. So this one is like someone who, today's we have smart vehicles, like
people are preferring the smart vehicles where they can drive and then they want to have rear and front cameras in their 360 view of the vehicle, and they want to drive it. So they're professional drivers, but this time they can do other things like for executives, they can even answer phone calls that are connected via Bluetooth to their phone, to their vehicle's uh, uh, tele-audio system, and all that is happening now because it is where AI is coming in. So medical procedures and then precision, that's the same thing applies to AI. In terms of our procedures and healthcare procedures, we can now have a greater opportunity to provide accurate procedures, and that is the power of artificial intelligence. Uh, the next one is AI in medical imaging. So artificial intelligence now in the gives us the opportunity that we imagine won't be possible many years back, and that is the artificial intelligence transforming the field of medical imaging by improving the efficiency and accuracy of image evaluation. So with the ability to quickly analyze various types of medical images, AI assists healthcare professionals in identifying potential health issues more effectively. So this technology streamlines the imaging process, allowing for quicker assessments. So improved detection, minimized errors, and faster analysis. You know, when you get a thing uh, like in radiology, once limited by human interpretation, speed and fatigue, so it's now being enhanced by AI systems that can analyze things like X-ray, CT scans, MRI scans, and ultrasound within seconds, or that with remarkable accuracy. And that is something that we believe. And when Cybersecurity PNG Limited and Artificial Pacific AI Consortium with Rapha Digital Healthcare combining, then our different technologies and expertise in three of these key areas that drives healthcare transformation, we believe that now the imaging and diagnosis and all these things would be with remarkable accuracy. So that should give doctors more time to really look at treating the patient and reducing readmission times and so forth. So with it is giving us AI with recovery remarkable accuracy. What is what that means is these systems are trained on millions of medical images. So they learn to recognize patterns and very, very small patterns and or anomalies that might go unnoticed by the human eye. So AI can highlight areas of concern, rank potential diagnosis, even provide uh, confidence scores and allow doctors to verify findings more efficiently and focus on complex decision making. So one of the kind of a myth is that they think that AI will replace doctors. It won't. AI is like a tool that doctors will now use to treat the patients better. So AI will empower the operation of doctors, because at the end of the day, whatever the AI gives, the doctor using his intelligence, human intelligence, will then analyze those findings and data as well before they commit down to like writing it as a prescription or as a uh, medical history and all that. That also needs to be AI with doctors working together. So it becomes AI becomes the assistant of doctors, so that it will help in improving the imaging. Next is AI in treatment development. So one of the most remarkable impacts of AI is in the treatment development and medical research. And traditionally, developing a new drug or therapy could take many years, probably 10 to 15 years, and a lot of money involved in that. And then from discovery to the health authorities giving the approval, bodies giving the approval to the drug or medicine that has been or therapy that was developed. So AI is helping drastically shortening that lifeline by accelerating every stage of the process, from target identification and things like molecule design or clinical testing and approval. So all of that now AI will now shorten the time. So artificial intelligence is revolutionizing the process of developing new treatments and significantly accelerating the introduction of innovative therapies. So by leveraging advanced algorithms and large data sets, AI can identify potential treatment candidates and more effectively than traditional methods. So this innovative approach reduces the time and cost associated with bringing new therapies to patients or even new medicine development. So now it's giving, so when it says large data sets, what it's collecting is that I mentioned something earlier when I mentioned that we don't, in Rapha Digital Healthcare, when we provide solutions to the PHAs or the National Department of Health, we do not propose to replace the systems. There is a huge data already, healthcare data already in those our PA and our healthcare system. So what AI does is that it goes and looks for data and patterns in that particular. So then within seconds and minutes, then it looks into like how Papua New Guinea came in the last 50 years. So all the medical data, all the mortality rates, and all of that is already in the systems. So when we allow AI to pull them up and look at it, then it tells the doctors and tells the healthcare professionals that, look, this is what we have come, and we are predicting that we will go like this. So then it gives a better idea on the administrators, policymakers, and also the doctors that are in the daily work there relating to patients and working with them. So that's AI in the treatment development. And then the next one is AI in patient care and monitoring. So artificial intelligence is now playing a transformative role in patient care and continuous health monitoring. So what that means is it helps clinicians and doctors stay connected to their patients beyond the hospitals or clinic. So with AI, healthcare is shifting from a reactive mode where doctors treat patients only after they fall ill to a proactive, preventative, and personalized approach. And that is something key here with AI. Previously, most of the time, especially in when people are sick, they go to the hospital and the doctor will see the symptoms and do diagnosis, and then they prescribe treatment. With artificial intelligence now, we will pass that stage, and now we go into a more proactive and preventive with a personalized approach. So artificial intelligence playing a crucial role in enhancing patient care and monitoring, enabling more personalized and proactive healthcare solutions. So AI-driven tools and applications allow healthcare providers to monitor patients' conditions in real time, leading to better health outcomes and improved quality of care. So in Rapha Digital Healthcare, we are not, like most of the time people ask me, are you a medical doctor? And I said, no, I'm not a medical doctor. But my expertise is in the digital technology, and that includes AI and cybersecurity. So what I'm telling them is, look, we are providing a platform where we are enhancing the work of the doctors to do what they are trained for and what they are best for. So we will give them the tools. So we believe that with our solutions, the readmission and the admission rate of hospitals should go down, because we are focusing, our solutions will help the healthcare authorities and all that to focus on public health side of things. So we don't, there may be components of like curative health and other nursing and all that is involved, but more focus should be on public health, because we all work together to create a better, safer community. So people should not go to hospitals to get medical attention. But when they do go, then AI will have the capacity to look at the history and then predict the future and give them a personalized care. So with a challenge like ours, with short number of doctors and below 1,000 doctors, and we have a bigger population, then AI will be able to help us in achieving that, to bring care to more people within a shorter time frame. So in this, we see that improved detection, real-time health analytics, and AI chatbot for patient support and remote monitoring. We realize that most of the time, the 80% of doctors' time is taken up by consultation. So, maybe treatment, maybe 20 or 10%. Doctors and some data should I believe should back that up. But from the broader broader information that is available, and from some conversations that we had, we found out that 80% of doctors' time is taken up by consultations. People just go in and then they try to explain the system to the doctor, and the doctor try to understand. So that takes most of the time. So with AI chatbots, and what we are offering is like apps that whoever is engaged in our services, then we will make apps available that the patients that would be coming in for any what, then they can ask AI to tell AI what their condition is, and AI can give them some general information. So we will cut that doctor's time that is taken up by chewed up by consultation to down to 10%, down to 20%, or even to zero. AI, when everybody, know how to accustom to AI chatbots and all that, then we can cut that down, and we can provide better and improved healthcare. So that's something on chatbots. It's a interesting one that in the websites, in the mobile apps, we can have the patients then can ask tell AI what the problem is, and then it can give them some information on what they want to do. And with Rapha Digital Healthcare, another thing that we're doing is that we are also assisting our doctors. And if you're a doctor listening, then or you'll be watching this, then we will provide a context at the end. So what we're doing is that we come up with a kind of a public chatbot that anybody can ask a doctor in PNG. So if your area is, let's say, in terms of different areas of medical care that doctors are providing and their expertise, AI will find out that of the 700 doctors, who can handle this query. So then it sends to that particular doctor, and then the patient and the doctor can communicate. And we're coming up with that platform that we want to give Papua New Guineans the benefit and opportunity that they can connect with our doctors that are attached to the public hospitals across the country. And they are based in towns and cities, and the rural people and others that are traveling and all that, when they want to quickly check something on them, they can quickly, and some information like body mass index and all that, AI can quickly calculate for you. Put in your age, you put in your height, and you put in your weight, and then AI will give you a body mass BMI and say that, look, you are healthy, overweight, obese class 1, obese class 2, 3 down the line. And then it will also give you options on how can you control your health and all, let's say food consumption and alcohol intake and all that. AI can assist in that. So, and when you go further into some specialist areas, then AI will refer you to a doctor and say that, look, talk to doctor that's based in Port Moresby General Hospital, and these are his contacts. You can call him or you can chat with him. So that's the kind of platform we believe that can transform and revolutionize healthcare in PNG. That's in patient care and monitoring. The next one is AI and healthcare administration. One of the less visible but most impactful areas, and that is of transformation, is the healthcare, the healthcare administration part of it. So while clinical technology often capture attention, the truth is that administrative inefficiencies are among the biggest causes of cost overruns, delays, burnouts in healthcare systems, not in PNG only, that's worldwide. So artificial intelligence is now tackling this problem head on. So AI is streamlining healthcare administration by automating routine tasks and improving efficiency. So AI tools help manage data, reduce administrative burdens, and optimize workflows, allowing healthcare professionals to focus more on patient care. So this can, in the administration side of it, it improves data management, automating administrative tasks, and optimizing workflows. So some of these repeated tasks AI will identify and then put automation in place and automatically doing things. So if, let's say, CEO of a provincial health authority or one of our major hospitals like the Port Moresby General Hospital have, let's say, regular meetings on a Tuesday or on a Wednesday, then instead of secretary organizing that, AI can automatically do that, and following up from the previous meeting and what would be the next meeting and the action items and all of that, AI can do that. So AI is a very big help in the administration sector of healthcare. AI in patient engagement. There is AI is significantly enhancing patient engagement by providing tools that foster communication and interaction between healthcare providers and patients. So these innovations help create a more personalized healthcare experience, improving patient satisfaction and enhanced to treatment adherence to treatment plans. So what it's doing is it complies with monitoring. AI tools help maintain compliance with healthcare regulations by monitoring data handling practices. And this is very critical because like healthcare industries are compliant with like global standards like the IPA or PCI, because when you deal with payment, all that the PCI payment card industry compliance comes in, or when you do with healthcare, then like that healthcare IPA comes in, and all of these different standards, global standards comes in. So AI will make sure that personalized data, meaning like a person's personal information, healthcare data should not be shared on, let's say, ChatGPT, for instance. Sometimes people will upload their medical confidential medical reports into AI to do some analytics, but in the, let's say, ChatGPT. But when ChatGPT got hacked or something, then that information can be leaked out. So with our AI patient engagement, the compliance monitoring is key area there. It makes sure that the healthcare data stays within the boundaries of particular healthcare systems and governed by the different countries' healthcare legislations and standards. And the other one is the incident response automation. In the event of security incident, AI can automate response to mitigate damage. This includes isolating affected systems and alerting IT personnel, thereby minimizing downtime and protecting patient care. Let's say there's a cyber attack in Port Moresby General Hospital. Before that happened, then AI can already detect it and then alerts the IT department that, look, there's something like this going on. So if you don't take action within the next 7 days or so, then it might affect the healthcare operation system. So if they neglect that one, then let's say the electronic medical record system might shut down. X-ray system might shut down by a cyber attack. So that's why we believe that Rapha Digital Healthcare is unique in our other competitors and people are providing the same. We bring the three important areas of digital healthcare, digital transformation together: cybersecurity, AI, and digital healthcare. And healthcare AI in data security is threat detection, data encryption, compliance monitoring, and incident response. I already touched on that. This is where cybersecurity PNG comes in, where we make sure that threats are mitigated, detected, and mitigated, and data is encrypted. So people who are not authorized to access, let's say, Port Moresby General Hospital's medical data should not have access to data that they're not supposed to. So all data will be encrypted, and AI will monitor compliance component of it, as well as in the event that there's a security incident, then AI can automate the response to mitigate the damage. So this includes isolating affected systems and alerting IT personnel. So that's where AI also comes in. AI in training and development, that's another area. Artificial intelligence is reshaping training and development within the healthcare sector by providing innovative tools and resources that enhance learning experiences for healthcare professionals. This technology facilitates ongoing education and skills development, ensuring that staff are equipped with the latest knowledge and techniques. And two of the parts that we at Rapha Digital Healthcare looking at is simulated training environments and personalized learning parts. So AI-powered simulation create realistic training scenarios for health professionals, allowing them to practice skills and decision making in a safer environment without risking patient safety. So we provide those that are engaging our services. They'll be provided with the simulated environment. So surgeons, probably doctors who are doing the residency, may simulate operations in AI-powered simulator environment. And then also we do AI can assist individual learning needs and create tailored training programs that match its professional skills level. So we see individual doctors and individual medical professionals seeing that whatever skills they are in and they need further, then we can customize personalized training for them. So in other words, the radio technician or the radiologist that is working in a hospital, they can have some knowledge on how to diagnose and troubleshoot a machine, for instance, or how to read or do getting scans and or sharing with others and all of that in a secure manner. That's what we are looking at. So that's the training component, and we believe that is something that is of greater importance. And back to our simulator, the chatbots, what we're doing is that we with our clients, we train the data models to understand the Irimotu and Tokpisin. So in the event that a mother from the village who doesn't know how to speak English, but when he speaks Tokpisin, then AI must understand and translate that and give the response also in Tokpisin. So then in Tokpisin, we have challenges like, let's say the Upper Islands dialect may be a little different from, let's say, the Nigini Islands, and probably the Bougainville, not autonomous region of Bougainville, as well as probably the southern region or Momase. They are different kind of a variant of Tokpisin that AI must be trained to understand, and then it gives a better simulation. So for instance, one probably a Western Islander or an Angan or a, let's say, Eastern Britain speak, then AI should have the capacity to understand the different styles and patterns of Tokpisin spoken by these different regions in our country. So that's where AI and training and development comes in. People are trained, and also the AI models also trained to understand each person in each region. That's on training. And the next is the challenges and considerations of AI in healthcare. While artificial intelligence offers numerous benefits to the healthcare, it also presents several challenges and considerations that must be addressed to ensure its successful implementation. Understanding these issues is essential for optimizing AI's impact on patient care. So one is data privacy and security and regulatory compliance. So that is also key in what we're delivering, because whatever we deliver must be delivered in a secure environment, and the confidentiality, the integrity and availability of healthcare data, patient care data must be maintained on all times. So confidentiality is the person who have the right access, and the person who is the right owner of that particular information must see it. And integrity is, if it's let's say diabetes class 2 report on a patient, then it must not change to class 3, for instance. Obese class 1, 2, 3. Whatever it is written in the report must be as it is. So nobody must be in between while the data is transmitting or while the data is addressed. There must not be any person affecting the integrity of the data and availability. So of course, the information must be available to the right person as and when that person needs it. So that's where the challenges are, and that's where it is a Rapha Digital Healthcare webinar and solution kind of a proposition, but why we are pulling in cybersecurity and Pacific AI Consortium into this one is reason is that cybersecurity PNG Limited brings in the cybersecurity aspect of what we're offering. And future trends in AI in healthcare, as artificial intelligence continue to evolve, several trends are emerging and that are likely to shape the future of healthcare. These advancements promise to enhance patient care and streamline healthcare delivery further. So that's increased personalization, enhanced predictive analytics, and integration of AI with telehealth. So these are already happening, and these are some trends, but some already, and we are already into that one. So that is, we are looking ahead, and there are more coming, and with 5G and these things happening, looking at AI-powered remote surgery, and so many things are on the horizon, and we believe that we want to position ourselves in the country, especially in PNG, as a viable partner, as a partner that the government and the National Department of Health with all the provincial health authorities can rely on us. So that brings us to the end of our webinar this morning. I tried to squeeze in within 30 minutes, but couldn't because of more information that I'm putting out. So thank you for your attention. And if you have any questions, the email address is there. Our WhatsApp number, mobile phone number is there. Email address is there. Website at the moment, we're trying to integrate our chatbot and things. So we took it off to work on a few things, but we'll be back on and we'll have AI capability on that. We are giving opportunity to our Papua New Guinea doctors who are in the public health sector, serving our people through the provision of their services to the people of Papua New Guinea via the public hospitals we have in the country. This opportunity where you can be reached and you can leverage your skills and enhance what you are called and you are appointed to do in this country. So we believe that of the 700 doctors, of the 11 million people in the country, the Lord, good Lord, as you know, give you that opportunity that you can serve the masses across the country. So with partnering with Rapha Digital Healthcare, we can leverage your skills and we can make the services available to any person in the country that does not have the luxury of traveling to Port Moresby or traveling to, let's say, Nonga-based hospital in Eastern Britain, or let's say Engau in Morobe, or Mount Elgon General Hospital in the Western Islands, that we can give them the opportunity. With that, thank you, and this brings us to the end of our webinar. And thank you for your participation. Thank you for your time. We believe that we all can work together. So we're inviting healthcare leaders, government agencies, academic institutions, and technology partners to collaborate with us in advancing this vision, and together we can make Papua New Guinea healthier and a better country for our citizens and ourselves to live in. Thank you.